My name is Alok Kumar. I am Principal Secretary Medical Education, Government of Uttar Pradesh. So globally, WHO norms require one doctor per thousand population, three nurses per thousand population. Uh, as the society is aging, the workforce, home-based care would require a larger number of nurses than what WHO standards is. And as of now, India at this point in time could be a potential supplier of workforce for the global market. So I will start with a story. So when we created these new medical colleges and when we went to recruit nurses for these new medical colleges, in one particular recruitment we had asked for 4,500 vacancies to be filled, and the Public Service Commission conducted an exam and we could fill only 3,000 positions. And then I asked, was there a dearth of candidates who were applying? And they told me that almost 100,000 candidates had applied, but only 3% could meet the minimum benchmark which the Public Service Commission set, which means essentially that we have nurses with valid degrees or diplomas in the market, job market, but they don't necessarily have the necessary knowledge or the skills. In the UPSC exam, we only test for the knowledge and therefore the skill is not even tested. But what we see in the market is that there is a gap. So the challenge now is to see how we can improve that. The other thing that is noticeable, and this I talk in reference to UP, out of the 100 seats available in the medical side, that is the MBBS or the PG or the super specialty, about 50% share comes from government colleges. Whereas in the nursing, it's only 2%, 98% come from the private colleges. So the large part of nursing output comes from the private colleges, or the dominant part, I think, the major part. So we had two-pronged strategy: A, to increase the supply of nursing from the government side, which we are doing. So from the 5 colleges, we have expanded to 22 colleges within the space of 1.5 years, and I think over the next 2 to 3 years, we will be expanding to the level of 50 colleges. But that would still cover about 5 to 7% of the output, and 93% of the output still will come from the private sector. Now, how do you improve the private sector? So how do you move them up the quality ladder? So we look at how do you affiliate institutions. So there are reforms in that affiliation process. Then how do we admit nursing students? Do we give it to hand it over to the private sector to select whosoever they want, or do we have a more centralized system of admission? So we have moved to a more centralized kind of a NEET exam for nursing for the state of UP that has been implemented. The third question is, at the output stage, when the nurse comes out into the market and gets the license to practice, do we test her adequately, both in the knowledge side, on the skill side? So that has been reformed, and that reform ensured that the passing percentage dropped from 90% to about 50%, 55, 60%. And this has now led to incentives for the private sector to improve quality, because now they know that, the business of usual, that you charge fees and in return you grant them degree, whether the degree comes along with the knowledge and the skill, commensurate skills. That business model is now becoming more and more untenable. Then we have the fifth item is, how do you attract bright talents to nursing? So we have, for instance, for the 8,000 medical seats, we have 1,80,000 applications. For 10,000 odd BSc nursing seats, we are barely able to get 20,000 applications. So how do we attract bright youngsters? So we are now going out to do career counseling in all the 10+2 colleges with science background students, where we are saying that nursing is a profession where you will be able to find a gainful employment. Lastly, we are also doing a credit rating of all these accreditations for all these nursing colleges universally, and we will be publishing the accreditation ratings by May this year, so that people will know, both the students will be knowing and the college will be knowing where they stand on the quality benchmark. And then we have a mentoring program where we pair relatively low quality institutes with best quality institutes and try to improve their quality in the teaching learning process over a period of time. And we have been doing this for about 1.5 to 2 years, and the results on ground are quite encouraging. And the next couple of years, when these batches pass out and come in the market, you'll find a qualitatively different nursing professional from what we see today. Requirement of nursing, paramedical and allied health professionals is going to rise, and we in India are not paying adequate attention to this. The indicators for this are salary levels of nurses compared to what their counterparts get in other developed economies, the promotion prospects, the amount of task and responsibilities that we devolve or delegate to the nurses as compared to the physicians and the doctors and the specialists, and the salary differentials. Typically speaking, Indian nurses receive far less salary as compared to their counterparts abroad. And that is why we are seeing very large number of vacancies. Let's say, for instance, NHS UK has almost 150,000 vacancies for nurses. Canadian systems, the Scandinavian countries, Japanese, they are all aging societies where there is a vast need for nursing professionals. But we in India, what we see is, if you look at some states, for instance, Kerala, they have 9 nurses per 1,000 population. Tamil Nadu, for instance, has 6 nurses per 1,000 populations. As I had said earlier, the WHO norm is 3, but they have far in excess of those norms, and that is why they are able to export those professionals outside. But consider a state like UP, we have only 0.6 nurses per 1,000 population. So we are 1/15th of what Kerala is, 1/5 of what WHO is, and therefore, for a state as populous as UP with 240 million people, we are a net importer of nursing professionals, not a net exporter. And the reason why we are unable to do so is because the quality of the nursing professionals which are coming out, the soft skills, so even if they are well trained in nursing skills, their communication skills, their ability to translate, to speak in the languages where they can be employed, and their ability to understand and comprehend and communicate, their bedside skills. So those are the soft skills that we don't pay adequate attention to, and that really is a constraint why we are unable to produce nursing professionals at the scale and with the quality that is desired to be able to be placed in international markets and even in well-paying Indian markets.